Hello. See, every day in clinical practice, I see a lot of patients where all the reports which they bring to me, everything is normal, and then they are still having problem of conceiving for more than 1 year. This is what is called as unexplained infertility. What happens when a couple is infertile? Usually after 1 year, they go for certain tests, like in the husband semen analysis they do, and that turns out to be normal. The count is normal, the motility is normal, the morphology is normal. Women, we generally ask for a scan. The uterus will be normal, eggs are forming, she's ovulating. Tube test, what we do, a HSG test, that will be evaluated, and all that will be normal. And still, these people are trying and to understand what is the reason for their infertility, but they're not getting an answer. So they think everything is normal and let me try naturally. Of course, within 1 year, if everything is normal, you can conceive. But after 1 year, the percentage of couple who conceive in unexplained infertility is very less. So there's no point wasting time. You have to go and meet your fertility specialist better than a gynecologist, because if a fertility specialist sees you, he can understand any minute causes which could cause this unexplained fertility. Then it is not anymore unexplained infertility. We get a reason for it, and then solving that problem, what is causing the infertility, will help you treat. But suppose even if you visit a fertility specialist, all the tests come out to be normal, then you usually what we do is three things. First, we do an super ovulation or ovulation induction, that we give you tablets for 5 days, usually letrozole or clomiphene for 5 days, and then we call you on the 11th day. We see the follicle monitoring, how the follicle is growing, and when it is around 18 to 20 millimeter, we give an injection for it to rupture, and at the same time we tell to have intercourse. This is called as ovulation induction and timed intercourse. In many people, just this 3 to 6 cycles of this helps in conceiving. If this is not happening, then the next step we do is super ovulation with IUI. This is having better success rate than just compared to ovulation induction and time intercourse. Here we prepare the sperm on the day when ovulation is happening, and we inject it into the uterus. This will also help them in conceiving. The success rate is around 15 to 20% in each time you do an IUI, and you can try maximum of 3 to 6 depending on your age. Younger women can try for a longer time, but if you are older, especially above 35, 1 to 2 cycles maximum of IUI is enough. The last, those who don't conceive with ovulation induction or IUI, for them the best treatment will be IVF. IVF is having a much higher success rate when compared to ovulation induction IUI. Then if you ask me, should I go directly for IVF? If you're in a hurry, if you're very old, if you're 38, 39, you want faster, then definitely you can try IVF directly. IVF has the highest success rate, but of course the cost is more. The effort, you'll have to take around injections daily for around 10 days. They are painless injections without any side effects, but still then you will not feel like going in for IVF directly, and unless it's very urgent or you're very old. But what I would suggest is, just don't keep wasting your time not trying, not doing anything, just hoping one day you'll get pregnant, and we don't know which day it is. What happens as the time flows, your egg quality, your egg number, your sperm quality, all these goes decreasing. So it's not advisable you keep waiting when you know you have a diagnosis of unexplained infertility. Nature is telling you there is a problem, but our tests are showing it is normal. Sometimes there are problem of mild endometriosis, which only if we do laparoscopy we get to know. That is missed out. Or there is sometimes a thickened zona, that is the covering of the egg, which will be thicker. Or the tube test we do, but the the activity of the cilia in the tubes we are not able to assess. So there will be some causes like this which will contribute to unexplained infertility, or sometimes immunological factors. There could be a reason like that. That is why they will not be conceiving. So we need to do a thorough test and try to find out as well. But just keep on doing tests then that will also be very expensive. So we don't need to do all the tests all the time, because irrespective of that, we'll have to follow these steps. And I would suggest all of you even to do some lifestyle changes which will add on and give you benefit. Like if you're obese, trying to reduce your weight, do exercise of 1 hour, reduce your stress levels. Taking supplements, antioxidants are proven to help have a great effect, especially on the oocyte quality and the sperm quality. So taking antioxidants, especially coenzyme Q, vitamin D, vitamin C, lycopene, melatonin, all these are useful antioxidants which you can consider taking. If you're drinking alcohol, please avoid it, either partner, and even smoking is harmful. So these lifestyle changes will definitely help you along with medical assistance. So do visit your fertility specialist and just don't sit on it. Thank you.